Hello, everyone. My name is Carrie Geis, and I'm an instructor here at UMA in the Medical Administrative Assistant Medical Office Billing Specialist program. I'm also a speech language pathologist, and my main focus is working with children and their families on teaching children who have difficulty communicating as well as difficulty feeding and swallowing disorders. Why that's important is that I work with a ton of families from a variety of different cultures. So I'm experienced in dealing with a variety within just in my community. The purpose of this lecture today is we're going to talk about why it's important to have cultural competence in healthcare setting, and we're going to specifically focus in on the Purnell's model of cultural competence that's discussed in your course readings this week. In this lecture, we're going to focus on what it means to be cultural competent. What is the Purnell model? We're going to identify all the domains and go into more detail about each domain within the model and why it's important as it's associated with therapeutic communication. What is cultural competence? Well, I found this blurb in a reading when I was doing some more research for information, and I felt like this was a great explanation. Cultural competence, it describes the ability of systems to provide care to patients with diverse values, beliefs, and behaviors, including the tailoring of healthcare delivery to meet your patient's social, cultural, and linguistic needs. When we talk about describing the ability of systems, we're talking about healthcare systems, doctors' offices, medical practices. In my case, my office of speech therapist, occupational and physical therapist. How do we meet the needs of our patients based on their social, cultural, and linguistic needs? And we say linguistic, that means language needs. Why is it important that we have cultural competence? That's a great question. Cultural competence is important because it's based on the respect of having respect of others. So it's really important that we have an understanding to show respect. When patients feel like they're respected, they tend to communicate more freely with medical practitioners, the doctors, the nurses, the office staff, when they feel like they're genuinely important. It will help decrease disparities in healthcare when they feel respected because we understand their culture and the way they are. They will have less disparities, less medical errors, better health outcomes. So it will help improve patient outcomes. It improves, obviously, patient satisfaction when they feel respected. The patient will also feel more empowered in their own health care. And we also need to understand patients at the individual or the micro level. In some of our previous lectures, we started talking about culture as a whole. And say the Asian Americans or Caucasian Western or your Latino or your Caribbean, that type, we're talking at the macro level. At this point, we're going to today start talking about more specifics about each individual characteristic of that particular culture. So like we've said before, cultures can be made up of, you can have a wide range and then you have little micro pieces within that culture. And that was why the Purnell model was developed. And the Purnell model is going to break down those different aspects of culture. And it's an assumption that can be made that when he developed this model, he felt like all of these different domains could be applied in any of the different cultures and that we encounter in a healthcare setting. So the 12 domains in general include heritage, communication, family roles and organization, workforce issues, bicultural ecology, and that would be more so skin coloring, just genetic characteristics and appearances, high-risk behaviors, nutrition, pregnancy and childbearing, death rituals, spirituality, healthcare practices, and healthcare practitioner. And the ones that I've highlighted in this presentation are the ones that your textbook has pulled out that focus more on that communication, that therapeutic communication piece, and why those are really important. So we're not going to talk about some of the other things and how it relates to patient care, but we're going to just really focus on the ones that are highlighted in yellow: communication, family roles, organization, spirituality, healthcare practices, and healthcare practitioners. Now, you might have some reasons, just like I've said before, is say I need to understand cultures for nutrition because I do specialize in feeding issues children who don't like to eat and those types of things. So that piece, that cultural domain would be important for me. The first domain we're going to talk about now is the communication domain. The communication domain, I've pulled out some of the characteristics about what it means. So what we need to focus in more on at the communication level. We need to understand what the dominant language is for that person or that family and what specific dialects are within that communication piece. That also could mean voice, volume, tone, intonation. All of those things are subtleties that lead us back to having a better understanding what might be important within that culture. Maybe not having any fluctuations in and what we call the prosody about how people ask questions or what they say, but also maybe they tend to speak at a louder volume, and that's not disrespectful. That just might be more normal. Actually, rate of speech, which is not listed, is one that what I look at frequently too, is sometimes there are more cultures that tend to speak faster than others. Willingness to share their thoughts and feelings. Some cultures tend to be more introverted and not to feel it's a sign of disrespect or a sign of weakness to actually share and show emotions or share their thoughts and feelings verbally with others. Nonverbal communication, we've touched on this before, really important that it means different things within different cultures. And this could mean when we talk about nonverbal communication, we talk about eye contact, facial expressions, touch, the ability, what's appropriate to touch and not touch, body language, what body language means, and special distancing practice. This might mean people entering your personal space. There are some people that we call them the close talkers, and that might be normal. And then there's some cultures that don't feel that close talking is appropriate. What's an acceptable greeting? This might be, the kiss on the cheek or a handshake, and now at this point we might have to be looking at elbow bumps as appropriate greetings and we say hello ma'am, no ma'am, yes ma'am. Then you also have time focus. Some focus, what they say or do might be more focused on what's happened, what's more important in the future, what's more important now, and what's more important or what's been important from the past. And also the use of names. Some feel you must address everybody with Miss, Mr., Sir, no sir, sir, ma'am. And there are some that it's more acceptable to just refer to people by their first name. I find that this is a big one that's variable within each culture. It can also be variable within each family. The next domain is family roles in healthcare. And this is where we're breaking it down as looking more specifically, what are the family roles? They look at what gender is with roles within each household. Some male, some female, which one's more important? And whose role is what? It might be, say, in family roles, the mother's the primary caregiver, the father is the primary breadwinner, or flip-flop. It could be the other way around, or who's the most important within that family structure or hierarchy, such as, like I said, the principal caregiver, who's considered the head of the household. Cultures can be very different. Sometimes the women are the head of the household, sometimes the man, or maybe there is no considered head of household. Everybody's on the same playing field. Their child rearing practices. This is really big because there are some that tend to be more doting and hand-holding, and their children are taught to be more dependent on the family parents or their caregiver. And then you've got some that the parents teach our children to be more independent. But that's also can be variable versus if it's a male child or a female child who's expected to do what's acceptable greetings, what are the roles of extended family members. There are some cultures that the family, the aunts, the uncles, the godparents, everybody has an important role within that family dynamic. And also what also makes a family roles is sometimes the social statuses and views towards alternative lifestyles can be variable within different family dynamics. Healthcare practices. This one's a big one, especially, and we've hit on some of these things before, is let's break it down even more. What's their focus on healthcare? Is it a preventative approach or the traditional approach, such as I get sick, I take medicine, or a mix of preventative and traditional? Are they more spiritually based, biomedically based, meaning very focused on medication, scientific research, or is it more of the folk medicine, that family, that traditions that get passed down from generation to generation? That American Indian culture is very much into the folk medicine, spirituality. Lots of it talk about that some of the healthcare issues that they might have are not within their control, that are controlled by other beings. What are their self-medication practices? Do they believe in medicating themselves on their own before they come in? It's very important that we know that. That's why doctors ask, what medications do you run? So you don't want to, sometimes those medications can cause more problems. That's why you're presenting an illness or disorder or disease or whatever it might be, or symptoms. What's the individual responsibility for their health? Are they responsible for their care, or are they do they see as the doctor needs to come in and fix everything, or will they take care of themselves? Lots of different views on mental illness. Some say it's choices. Some say it's chemically based in the brain. Some think it's maybe a mix of both. Some healthcare practices, they don't believe in organ donation or transplantation. This means the body needs to be buried the way undamaged in their terms. Some religions and some cultures don't believe having tattoos or ear piercings and things like that, because that's damaging to the body. So they might not believe in organ donation, transplantation. And also their response to pain. Some say, well, we don't want to show any of my response to pain. But, or some tend to maybe over-exaggerate their responses to pain. Important to know. The next one is healthcare practitioners. Different cultures have different beliefs in healthcare practitioners. So they might have various perceptions. This such being, an example would be in my office, we have some that feel that they don't want a male speech therapist to work with their daughter. This might be, a female only wanting to go to a female doctor, or male only wanting to go to a male doctor, how they perceive it. Sometimes we can become very offended if people are making choices based on genders and age. I'm sure some of you have seen this before. Somebody young walks in the room, you're going to make a perception of, oh, this person can't care for me, or doesn't have the knowledge base that maybe, say, an older medical practitioner might have. Or it might be flipped. I find that sometimes the younger generation tends to have newer ideas and be open to more novel and new science, versus some of your older healthcare providers tend to stick with what they know and they've been doing for so long. And then also the role of folk practitioners. Some believe in it, some don't believe in it. Some, like we said before, some of the more spiritually based believe in going back to the whole folk medicine, where then now you have some that believe, no way, can't do it, won't do it. It's not what I want for me or my family. So those are the spirituality. Spirituality is another piece that we have to keep in mind. What spirituality means: religious practices. What are the use of those practices? What, not only do they believe in them, what do they do? What behaviors that they give meaning to life. So they might do certain things that's what's important for them. There's certain behaviors of what's important to their culture and why they should be doing it. Where do they pull their individual source of strength? Is that source of strength through prayer? Is it through family? Is it through medication, reliance on other medical professionals? And then there's also the piece of religious taboos. That's really important, because sometimes we have to keep in mind what they feel is, what some people feel is inappropriate or superstitious, I guess you should say, within their culture. Ways to obtain information about this. Well, it's great that we have all of this background knowledge, but we know what we're looking for based on Purnell's model. But how are we going to get that information from our patients? How are we going to get it without insulting, or just trying to find out where it's most appropriate and where your place is to ask? They also need to know why you need to know. So Some places use questionnaires. I'm sure some of you have filled out some of these questionnaires in the past. So you kind of have an idea of what things are asking for. Ask openly about possible relevant traditions and customs. And that kind of ties into the using normalizing statements to ask. And that means say, well, I know that sometimes you might have people have certain ways of how they act or they believe. Would you mind sharing with me some of those things that you believe that will help me better care for you and provide better services for you? So that's kind of a normalizing way to ask questions, and you're letting them know the reason why, not to be nosy, but just to help you provide better care to that patient. Making sure you establish clear communication with them, and that means breaking down that language barrier right away so they can understand what you're asking, and that might mean bringing in an interpreter or a family member who can interpret for you, but making sure that it's clear communication, because that can be a huge barrier for obtaining the information that you need. I find when I work with families, sometimes I have to ask the questions in multiple ways and non-offensive ways to be able to get the answers that I'm trying to get to, and they can understand, because sometimes they don't understand. Don't jump to conclusions. Don't just decide, okay, well, because they look a certain way or their name is a certain name, that this is the way they're going to act, or this is the way I should ask my questions. Don't jump to any conclusions. And remember, you have to be very aware of your self-bias to making sure when you're asking those questions or you're not jumping to any conclusions. And that's kind of where we talked about identifying barriers to culture, to communication. In summary, just to kind of wrap everything up that we just kind of talked about today, is having cultural competence is vital for healthcare in our healthcare system, to provide healthcare that's appropriate, to make sure that we're meeting our patients' needs. So we have to have an understanding of what are the pieces of each culture, and we broke this down more into some of the microculture pieces that we need to look at that are more specifically related to healthcare communication, such as family roles, healthcare practices, health practitioners, those pieces that we talked about today. And we also need to find ways to obtain the information from our patients specifically. So when we talked about before is maybe reading up on different cultures and having that understanding, is now we need to break that down into a smaller piece and learn those individual nuances to provide that patient care. So with that information, I hope that you have learned something new. We're going to talk more specifically about some of the different pieces of individual cultures at a later time in one of our next lectures. I hope you have a great day.